Ever wondered why some people over 65 can read fine print without glasses, while others struggle to recognise faces? The secret isn't luck, it's timely and proactive eye care. Today, we're going to break down 5 critical vision changes that can occur after age 65, and why you absolutely shouldn't ignore them. I promise, you'll learn how to maintain sharp vision for many years to come. Our eyes are incredibly sophisticated cameras, working tirelessly for decades. Naturally, with age, like any intricate mechanism, they begin to show wear and tear. Vision problems after 65 aren't always just simple age-related farsightedness. They can be serious conditions that quietly steal your vision. And most importantly, many of these can be successfully treated if caught early. The key is knowing what signs to look out for. All right, let's dive into our list. Let's kick things off with a topic many of you have probably heard about, but might not fully understand. Cataracts. It's not just a fancy medical term. Essentially, a cataract is a clouding of your eye's natural lens. Picture looking at the world through a foggy or even a dirty window. That's exactly how the world appears to someone developing cataracts. It's not a sudden onset condition. More often than not, it's a slow, gradual process that develops over years, steadily dimming your world and deteriorating your vision. But what are the actual signs and symptoms? They can be quite deceptive and manifest in various ways. Perhaps you'll start noticing that everything around you seems a little hazy, almost as if a thin fog or a persistent film is constantly draped over your vision. Or perhaps at night, you'll start seeing strange halos around light sources, like oncoming car headlights or street lights, making night driving particularly challenging. Sometimes people even experience double vision, but only in one eye, a symptom that can be quite alarming. And to add to that, the vibrant colours of the world might start to lose their intensity, appearing faded, dull or yellowish. Unfortunately, far too many people tend to ignore these early warning signs. They often dismiss them as simple eye strain, a demanding day, or, most frequently, as an unavoidable part of ageing. Oh well, it's just what happens when you get older, they might rationalise, until their vision has deteriorated to a critical level, severely disrupting their daily life. And this, my friends, is a major misconception. But here's the good news. Modern medicine offers a remarkably simple and incredibly effective solution. There's absolutely no need to suffer in discomfort. Today's cataract surgery, which involves replacing the clouded natural lens with a clear artificial one, is a quick, safe, and profoundly effective procedure. It truly restores the clarity and vibrancy of the world, much like wiping clean that foggy window. The key takeaway here is, don't wait. Now let's talk about the real silent thief of sight, glaucoma. It's not just an eye disease, it's an insidious condition where the optic nerve is gradually, yet relentlessly, damaged. The optic nerve, by the way, is the crucial cable that transmits all visual information from your eye directly to your brain. Most often, this damage occurs due to elevated intraocular pressure. Though there are exceptions, this is precisely where the main danger of glaucoma lies. It often develops without any pain or obvious symptoms in its early stages. You might be slowly losing your peripheral vision day by day without even realizing it. Your field of vision narrows, as if you're looking through a gradually closing tunnel, but your brain is so clever at compensating for these losses that you might only realize there's a problem when a significant portion of your vision is already irreversibly gone. Risk factors include age. The older you get, the higher the risk. If you have a family history of glaucoma, genetics play a significant role. And of course, high intraocular pressure is the primary suspect. This is precisely why regular eye exams with an ophthalmologist are so crucial, even if you feel your eyes are perfectly fine. So how can you avoid missing glaucoma, this invisible enemy? There's only one way: regular visits to your ophthalmologist. During such a visit, your doctor will measure your intraocular pressure and thoroughly examine your optic nerve. Think of it like a regular service check for your car, but far more important, because it's about your priceless vision. Timely detection is truly the key to successful treatment and preserving your eyesight. And the third crucial condition we absolutely cannot afford to ignore is age-related macular degeneration, or AMD for short. This is a condition that affects the central part of your retina, what's called the macula. The macula, for the record, is arguably the most vital area of your retina, as it's responsible for sharp, central vision. It's what allows us to read, recognize faces, and truly see fine details. Without a healthy macula, the world literally blurs right at its center. So, what are the telltale signs of this often stealthy AMD? Symptoms can begin subtly, with straight lines starting to appear distorted. For instance, a door frame or window sash might suddenly look wavy, almost as if you're looking through a funhouse mirror. Or, even more alarmingly, a dark or blurry spot might emerge right in the center of your field of vision, making it hard to see clearly. Tasks like reading a book or recognizing faces become increasingly difficult and sometimes even impossible. It's crucial to understand that there are two main forms of AMD, dry and wet. The dry form is significantly more common and generally progresses slowly, gradually diminishing your vision over time. The wet form, however, is a much more aggressive and rapidly progressing condition that demands immediate medical intervention. It arises when abnormal blood vessels begin to grow beneath the retina. These fragile vessels can leak fluid or blood, leading to sudden and often severe vision loss. So, can you slow the progression of AMD? Absolutely. A proper, antioxidant-rich diet, specialized vitamin supplements specifically formulated for eye health, and a healthy lifestyle overall play a huge role. Think of it as your body's internal sunscreen, protecting your eyes from within. Quitting smoking is also critically important, as it significantly increases your risk of developing AMD. And finally, regular comprehensive eye exams are key to catching any changes early and starting treatment promptly. The fourth, and often underestimated condition, particularly for those with coexisting health issues, is diabetic retinopathy. As the name suggests, it's directly linked to diabetes. It stands as one of the most serious complications of diabetes, specifically affecting the tiny blood vessels in the retina. When blood sugar levels remain consistently high over time, these delicate vessels can become damaged, start to leak, swell, or even become blocked. What makes early-stage diabetic retinopathy particularly insidious is the frequent lack of symptoms. Many people experience no noticeable vision changes until the disease is quite advanced. Alternatively, you might start to see floaters, those shadowy shapes or spots that drift across your vision, appearing and disappearing. Intermittent blurry vision, which comes and goes, can also occur, often leading people to dismiss it as simple eye strain or fatigue. So, when should you truly be concerned and seek medical attention? If blurry vision becomes constant, you notice dark spots that don't go away, or even perceive something resembling threads or cobwebs, these could be signs of bleeding into the vitreous humour of your eye. Do not wait for these symptoms to become critical, or for your vision to suddenly worsen. Any of these warning signs should prompt an immediate consultation with an eye specialist. The most crucial and effective measure against diabetic retinopathy is strict and consistent blood sugar control. Equally important is managing your blood pressure. Don't assume your eyes will just handle it on their own, or that minor fluctuations in blood sugar won't cause harm. This is a myth that could ultimately cost you your sight. For individuals with diabetes, regular eye exams are not just a recommendation, they are a vital necessity. Fifth, and often underestimated, yet a source of significant discomfort and potential problems, are dry eye syndrome and presbyopia, also known as age-related farsightedness. As we get older, the tear glands responsible for keeping our eyes moist naturally become less efficient. While this is a normal part of aging, it can be quite bothersome. Have you ever experienced a gritty feeling in your eyes? A persistent burning sensation? Or perhaps your eyes start watering uncontrollably when you're in the wind? These are all classic signs of dry eye syndrome. Not only does it diminish your quality of life, but it also makes your eyes more vulnerable. Insufficient lubrication increases the risk of infections and tiny abrasions on the eye's surface. Moving on, let's discuss presbyopia, or age-related farsightedness. This is when you suddenly find yourself struggling to see up close. You might have to hold books or your phone further away to read small print. It's important to understand this isn't a disease or a serious diagnosis. It simply means your eye's lens naturally loses elasticity with age, making it harder to focus on nearby objects. However, don't fall into the trap of thinking, "Oh, it's just age, there's nothing I can do." That's a huge misconception. Presbyopia is easily remedied. All it takes is a proper pair of reading glasses or specialised contact lenses, and dry eyes can be effectively managed with lubricating eye drops, often called artificial tears. These will quickly alleviate discomfort and help protect your eyes. Remember, regular comprehensive eye exams are your best defence to catch these changes at their earliest stage. Your eyes deserve that attention. So, we've covered the 5 key vision changes you might experience after age 65: cataracts, glaucoma, age-related macular degeneration, diabetic retinopathy, and finally, dry eye syndrome and presbyopia. The good news is that many of these conditions, once considered an inevitable part of aging, can now be successfully treated or managed. What's crucial is your awareness and willingness to take action. Don't wait until your vision starts to decline. Be proactive. Thank you for taking the time to invest in your eye health. If you found this video helpful, please give it a like and subscribe to the channel. And in the comments below, let us know which of these conditions surprised you the most, or what you'll now be looking out for. Your feedback is important to us.